this is incredibly topical. We have the whole subject of conflicts of interest, who pays whom and what they get for it has been of massive interest to journalists like me for a very long time, and it's very interesting to see developments not only in the pharmaceutical industry but many other areas as well within medicine and healthcare.
The ABPI Code of Practice hasn't been a static thing, it's developed and grown, and the disclosing of payments to doctors and nurses and clinical professionals was a big and important step, and the creation of a searchable database is a powerful and important step. I don't think anyone thinks it's the last word, but these are really tangible and important leadership moments that are changing the culture in the industry internationally.
Really, it's an opportunity for us to disclose not only on the issues of payments, but really why those payments happen. So what are the participations, what are the collaborations that we're involved with doctors and nurses and patients, and really excited to do that because we think this is fundamental to the way we drive innovation in medicine. So really happy to be here today.
It's very important when we are commissioning healthcare today that we see that conflict and payment, whether it's relevant coming through, funding streams for work programs. So there's a whole issue around funding and also an issue about conflict that we need to have in the transparency out there in the public domain.
It's critically important if you're going to deliver solutions and be successful for patients. It goes without saying that you need to collaborate. So we've actually been at the forefront of collaboration with all stakeholders, including industry, actually for 20 years. And we now pretty much partner with industry in almost everything we do in the context of research. But at every step we have to be transparent and open, and if we're not prepared to do that, then we shouldn't be doing what we're doing.
We need to just remember we need industry. We need industry to invest, to bring their discipline, their skills, to bring us these products. Somebody made the point earlier, very few of us would be sitting here healthy as we are tonight if it wasn't for this industry's achievements in the last 50 years. 850,000 people living with cancer now as a treatable disease. It's an extraordinary industry and we should celebrate it. But we can't take industry for granted. And I worry that a total anti-industry based approach to total transparency, we will end up, there's a danger we end up killing the goose that lays the golden egg.
The industry has been on a journey, I would say, a pathway to changing the way that we operate, and disclosure really is a significant step forward in terms of transparency of payments.
Allowing doctors to voluntarily declare their earnings from industry but not say what that was for, I think is actually wrong, and I think could make the situation worse. It may appear that we're doing more when actually we're doing less. We may be allowing a small amount of doctors to really play the system.
And actually it's absolutely appropriate that we pay the right amount for that advice, as you do in any industry when you get expertise.
If we could actually work with the pharmaceutical industry and not consider them to be the evil empire, okay, and their names only plastered on the front page if they do something wrong, and not mentioned at all when they do have a breakthrough drug, which happens all the time, then I think you'll find that people will be much happier to disclose.
And as a professional body, we've been really clear that we expect people to declare everything and any interest they have.
I fundamentally believe that the collaboration is critically important to the furtherment of pharmaceutical science, and if we can't do that and do that in a way that both parties, are happy about it, then, I think that's really doing patients a disservice.
If we put patient voice right at the heart of this, I don't think we can go far wrong, and I think that will accelerate us into this landscape of a more transparent healthcare innovation ecosystem, which I think is genuinely in the interests of all of us, and it offers a win-win-win for patients, for the NHS and for industry.